Yeah, this is Dr. Buford. I'm here with one of our regenerative medicine patients. And the reason why we're having this little chat today is because this is your 2-month follow-up visit after getting stem cell injections in both glenohumeral joints and both shoulder subacromial spaces. Just a little bit of back history. How old are you now?
62.
62. And you'd been told for years that you need shoulder replacements on both shoulders, correct?
On my right.
On the right?
Shoulder replacement.
Okay, very good. And we've been managing that, I say you've been managing that in Oklahoma with narcotic medications because of the level of pain. Is that
right?
Pretty accurate? Do you know exactly how much you were taking before the procedure in terms of dosages or which medications?
I was taking, I don't know if OxyContin or oxycodone is, which one's the long-acting one, but I took 20 milligrams every 12 hours of the long-acting one, and then I had 6 10-milligram breakthrough of the short-acting one, and I was taking more than the 6.
How long were you doing that kind of protocol or regimen?
A couple of months, because prior to that I was on 40 milligrams twice a day, and every 12 hours, and so I was on more medicine, and due to the opioid nightmare, the doctor cut it back.
He was working on weaning you off. And so because you were still having pain, and because you and your pain management doctor knew that there was a time in the future that he wasn't going to be prescribing, you sought out some alternative options. You came down to see us here at the Dallas PRP and Stem Cell Institute. We talked about the 2 primary orthobiologics that we use, being platelet-rich plasma and bone marrow-derived stem cells. And 2 months ago, you opted to have that bone marrow-derived stem cell procedure in the office. I understand you had a rough 4 days. That's what we've been talking about. Tell me a little bit about that. That sounds like a tremendous inflammatory reaction.
Well, after about 12 hours after I had it done, I couldn't move either one of my arms, and it was just extremely painful. I had some cream that I could put on that had a painkiller in it. I was having to put it on my arms, not just my shoulders, but it was my whole arms.
And then
for
after
about 4 days, I couldn't hardly move my arms.
And so after 4 days, that let up, and that got rapidly better. Tell me where we're at now. So we're 2 months out now. Tell me about your pain level. Are you having?
Well, I have a low enough pain level. I have a few more days of the OxyContin and oxycodone in the morning, and then I'll be weaned off of it. But I haven't taken, at least in the last month, I haven't taken any more breakthrough pain medicine during the day, and not at night.
So we're talking about almost 30 to 40 milligrams of narcotic that you've decreased even further.
Right.
Excellent. And then on the right shoulder, let me see your motion. Just raise that right arm up. This is the one you were told you needed a shoulder replacement on, right?
Right.
And then come out to the side and behind your back. And I've seen your x-ray, obviously. You do have very minimal joint space on the right. How about on the left? This is the one where you have more restricted motion. Good. And come straight to the front. Straight up. And you gave us a SANE score of about 50% better. How do you think, well, let me ask it a different way. Would you do the procedure again at this point?
Yes.
Yeah. Okay. Any other comments about where you're at today?
Well, no, I don't think so.
Okay, thank you so much. Okay? Bye-bye.